The fresh cases of COVID-19, the new variant, of course, and the active cases in our country at the moment. Let's talk all about it. India is seeing a sudden resurgence in COVID-19 cases with new infections reported from the national capital, Haryana, Kerala, Karnataka as well as Andhra Pradesh. According to Union Health Ministry data, there is 257 active cases at the moment in our country. Delhi NCR has reported 27 COVID-19 cases as national tally also sees an uptick. Of the total number of positive cases, 23 were reported here in the national capital. Now, Delhi government has issued an advisory in view of the recent increase in COVID-19 cases. It has advised to ensure hospital preparedness in terms of availability of beds, oxygen, antibiotics and other drugs and vaccines. In Uttar Pradesh, 4 new COVID cases have been reported from Ghaziabad. Haryana has recorded 4 mild cases till now, all of whom are also now under the home isolation. Post that from Karnataka, it has been reported that there are 35 active COVID-19 cases, of which 32 are from Bengaluru. 3 babies have been tested COVID positive in Bengaluru, including a 9-month-old baby. Now shifting focus to Andhra Pradesh, that reported 4 new cases, of which 3 are from Visakhapatnam and 1 from Kadapa. Then talking about Kerala, it also continues to be the most affected as it has recorded 273 cases in the month of May itself. Kerala, in fact, currently reports the highest number of active cases at the moment, that stands at the tally of 69. Now, while the situation is currently under control, health departments are urging the people to be alert and abide with safety protocols. Meanwhile, Kerala state health authorities have issued fresh guidelines urging mask use and also caution, especially among the vulnerable groups. The Karnataka Department of Health and Family Welfare on Friday issued a fresh advisory which states that vulnerable groups, including pregnant women, children, individuals with weakened immune systems and also those with pre-existing health conditions, wear face masks in crowded areas. Speaking about the state of Andhra Pradesh, the Department of Health, Medical Education and Family Welfare has now issued a set of guidelines for the state, one of which asks the public to wear a mask compulsorily in crowded places and also while you are on move, while you are in transit. Let's discuss this new variant, the cause, the symptoms and the cure as well. Disease expert and Secretary General, People Health Organization of Mumbai, Dr. Ishwar Gilada, joining us on the broadcast. So thank you so much for speaking to News9. First up, is this a fresh variant and how different is it from the previous 2 dastardly waves that India had to go through?
You see, Sakshi, thank you very much for having me on the show. First and foremost, I would like to clear the doubts of people. This is not a variant, this is a subvariant.
Okay.
This is a lineage of the Omicron. Omicron in India, it was initially BA.2, then BA.2.86, now JN.1. So JN.1, or what they have seen in America just yesterday in last 10 days of surveillance, that people arriving from China and nearby China countries, they had a new subvariant called NB1.8.1. So all these subvariants are descendants of Omicron, and Omicron itself is a mild virus. So if you compare whatever 5 variants we have seen, Alpha, Beta, Gamma, Delta and Omicron, out of which Delta was the most dangerous one, where we have seen the surge and a lot of people died during that time, and it was okay, it created a lot of oxygen demand, ICU demand, ventilator demand. But after that, when Omicron came, I called it that Omicron is a variant of support for India. Only after Omicron came, economy opened up, schools and colleges opened up, businesses opened up, work from home stopped, people started going to offices, and most people got Omicron infection at least once. The advantage with India is that we had a number 1 very good vaccine. Covishield, almost 91% of the Indians took Covishield and 8 to 9% took Covaxin. Both the vaccines were better than the vaccine which was used in China and nearby China countries, which is Sinovac. They were better than other vaccines, even by mRNA, Pfizer or Moderna. Number 2, lot of people got already infected with Omicron. So new subvariant of Omicron, it will trouble only little, it will not trouble a lot. And number 3, most of us had taken 2 doses and 40% of us have taken 3 doses, which is kind of a booster. Now, a lot of people don't understand that vaccine has two kind of immunity, vaccine and the infection. One is a overt and one is a covert. Overt is seen, where you can quantify by doing test that yes, this person has a immunity. But there is also a covert immunity, which is called memory cells. And in memory cells, uh, our past infection or particular infection is stored. Similarly, vaccine is stored. As soon as a similar new infection comes, our memory cells get activated and we can fight with that infection. Only if the new variant comes, which is equivalent to or more severe than Delta, then we are in trouble. Now that is one thing. Secondly, whenever new infections come and surge is there in and around, we people get worried. But we are not worried about influenza. We are not worried about RSV, that is a respiratory syncytial virus. And we are worried about COVID now. If you look at it, the behavior of all three viruses is similar. Only it depends on which season is going on, that virus is up and others are down. So usually influenza A and B, and there are two type of influenza A and two type of influenza B. So those four viruses, they are very common. Then respiratory syncytial virus RSV, that is very common. Now COVID is replacing them. So if we are not worried about influenza, if we are not worried about RSV, we should not be worried about COVID, because COVID is like a flu. Let us call it COVID flu. But because we suffered a lot, because everybody had some memory, therefore we get scared as soon as some cases come.